What's up, guys? So I'm on my way to work, and I just want to know, how are you all surviving through this COVID thing with your work schedule? Because like on Facebook and everything, I know a lot of people are out of work in certain places due to shutdown, but in certain areas they are reopening, but there are certain types of jobs who the employees, they can no longer work because they can't follow the recommendations or whatever. They just haven't opened up yet. But I'm hearing like from a lot of people who don't work in a hospital, they're saying that we're all set and we all have income coming in, but that's really not true, because it's hitting hospital workers too. A lot of us are being canceled, sent home early, and depending on the facility that you work for and how good the company is that you work for and how they treat their employees, a lot of people that are in healthcare are out of work, even though we're labeled essential workers. I know for one, for the whole month of May, at one of my jobs at the hospital, they eliminated all PCTs, full-time, part-time, PRN. They took them all off the schedule. They took us all off the schedule. And with this particular company, which I'm kind of like iffy about joining to when I become a nurse, is because of how they treat their employees. They don't treat them right. So they were canceling me, and they didn't even give me the decency to tell me the reason why I was being canceled and what they were planning going forward and how they were planning to help their employees continue to bring income in for their families. It was just like, you're canceled, bye. And it was just like so heartless the way it was done. And I think that was wrong. Now, my other hospital that I worked with, they had the decency to call me and say, listen, we're going to be taking a lot of people, taking you off the schedule for these days. This is because I put in for extra. But the schedule that you're currently on, you can keep it. But if we don't have any needs, we may have to cancel you. And how they were canceling people so that everybody can bring in something, when it was time to get paid. Even though I am casual pool, I'm the lowest pool, which means that I have the least commitments. I don't have any requirements. They still allowed me to work. If they cancel me one night, they're not going to cancel me again just because I'm pool. Everyone, it takes turns to be canceled as opposed to the other job. And I thought that was very considerate and that was very caring on their part. And I respect them for that. And for that reason, when I become a nurse, that's the company that I'm going with, because they care a lot for their employees. We're constantly in communication. No one is going on strike and no one is protesting against them because they treat their employees right. And I'm just grateful for working for that company. And I don't see myself leaving that company. No, I can't. Not for the other one that I have, that I'm working for. I'm just doing it PRN just to bring extra money, just in case it's just my little hustle. That's like my little side hustle. But and I'm hearing like from my other friends working other places, they're being canceled, and some of them haven't brought in income for like a month because they keep canceling them. And a lot of people are not coming to the hospital. Hospitals, they're not as full as they used to be, and a lot of people are scared to come into the hospital. They rather just deal with their issues at home so that they won't come to the hospital and get something worse. People are afraid. So because our jobs depend on patients coming in, which is very little, so many empty beds is ridiculous. A lot of healthcare workers are not working. they're getting canceled too. Just because we're essential workers doesn't mean that we're essentially working. We're not. Some people are not. And nurses are being canceled. PCTs are being canceled. Everyone that have certain jobs, respiratory, all of that, because of the needs. There's not enough patients for the workers to care for. So they're not working. And some companies or hospitals are laying off, or you could say a temporary layoff, some positions, and people are not working. So I just want to know what's going on at your facility, because at my facility, we are being canceled a lot. And at the other facility that I work with that I highly respect and love, if we're not canceled, we are floating a lot, which I am essentially grateful, because I don't care about floating, because I think I made a video about floating before. Floating, the hardest part of floating is not actually leaving the place that you're used to, but it's actually working with new people, because a patient is a patient. No matter what floor you're working on, you're doing the same thing for the patient. It's the people that you have to work with. That's why I say when you're floated, you show yourself friendly. You go in there with a nice attitude. Don't go in there with an attitude like, I don't want to be here, and that type of attitude, because that's how your night is going to go. If you want help, if you want to create a pleasant atmosphere for you to work in, you be the one to initiate that. Don't expect them to do it, because it's like some type of aura in the air when you go to float. It's like, you don't belong to us, we don't know you, so you're the new person. And it's like that everywhere. School, whatever, you're the new person, and you'll be like a nursing school student goes to their clinical site, and they're standing there for like 10 minutes, and no one is going up to them saying, oh, how can I help you? You're a nursing student, and no. As a nursing student, you have to open up your mouth, say, yes, we are nursing students, and we have been assigned here. You have to say something, because you'll be standing there forever. It's the same thing with floating. If you go to your assignment, your assigned floor that you're floating to, and you have to say, my name is, and I was sent here, I'm floated here, what is my assignment? You have to initiate the conversation, because you'll just be standing there looking like, a lost person, and no one's going to come up to you and be like, ha. No, they're not going to do that. For some reason, they don't. Unless the person is really nice. You might get one person to do that, but 9 times out of 10, it's not happening. So if we're not canceled, we're floated. Like I'm going in tonight, and tonight I just might be floated. Instead of 3 PCTs on our unit, it is 2. And because I am the float pool, I'm usually the one that's getting floated. If they're not going to keep all 3 of us, and I'm totally fine with that, because it's my experience also that when I float, I have a better night. I don't know, guys. So yeah. So what are they doing at your facilities? I mean, are they canceling y'all? I know things are not going to get back to normal for a couple of months now, even maybe a year or so, because right after this, it's going to be flu season again, and people are going to be terrified to come back into the hospital. So I think, in my opinion, this thing is going to happen all over again. And also, they put out a hiring freeze on new nurses. So I'm kind of freaked out about that, because when I graduate in December, if I graduate, because I really don't know what's going on with the nursing program, because they haven't told us anything, so I really don't know. We're in limbo right now. I'm waiting to hear back from what they're going to do, how we're going to do it, because I have not finished out this semester, because we couldn't finish clinicals, and our semesters go together with the clinicals. So if we don't finish clinicals, then that means we don't finish out the semester. So I don't know how they're doing it. Whenever they get back to us, I still don't know what's going on. They don't know what's going on. It's already June, going to be June, and we're at the end of May. and we still have not heard anything. So I don't know, but they have put out a hiring freeze at, I think, both my jobs. They sent out emails, so I may not be able to get a nursing job for maybe another year after I graduate. So I don't know, guys. Y'all let me know what's going on out there. Thanks for watching this video. Talk to you. Bye.